There are 9 major gaps that you would think original Medicare would cover, but it does not. So let's go over those 9 major gaps and we'll help you understand how to fill them. These 9 gaps are going to be split into 2 different categories. The first 5 are going to fall into one category and the last 4 are going to fall into a different category. So starting with those first 5, the first would be prescription drug coverage. So original Medicare does not include prescription drug coverage. This is separate. And there are 2 ways that you can cover this. The first is through a Medicare Advantage plan. Most Medicare Advantage plans have prescription drug coverage included in them and included in your Medicare Advantage premium, which could be $0 or very low. The second way that you can cover prescription drugs, if you were to go, for example, the Medicare supplement route, would be to purchase a standalone prescription drug plan, which you can do, and insurance companies offer those. They're just separate from the supplement plan that you would purchase. The second gap to discuss would be dental services. That is not covered by original Medicare with a few exceptions. If you need dental surgery, for example, if you get cancer in your mouth and you would need dental surgery in order to get that to happen, that may be covered by Medicare. Or if you need some sort of dental screening before a procedure, that may be covered by original Medicare. But for the most part, what you would generally think of as routine dental services, not covered under Medicare. Like the first example, most Medicare Advantage plans have dental included in that, so it's going to be included in your Advantage plan. Or if you go the supplement plan route, you can purchase a separate standalone dental plan. They have senior dental plans, individual dental plans, discount dental plans. There are a lot of options there for you if you're looking for dental coverage, but again, it's not covered by original Medicare. The third and fourth gaps are both related. It would be routine vision care, glasses, and contacts. So those are not covered by original Medicare. Like the previous 2 examples, they are often included in Medicare Advantage plans, or if you were to go the Medicare supplement plan route, you can purchase standalone vision plans and glasses and contact plans through insurance companies that are just separate from everything else. The fifth and final gap of this first bundle of 5 would be hearing aids. So hearing aids are not covered under original Medicare. Like the previous 4 gaps that we've already discussed, oftentimes hearing aid discounts or hearing aid coverage of some form is included in Medicare Advantage plans. If you go the Medicare supplement plan route, again, there are discount programs and plans that you can purchase around hearing aids. So what those first 5 have in common is that in general, they are lower cost items with the exception of prescription drugs. That can get to be a hefty cost, but for the most part, they're lower cost items. And the 5 of those are almost always included in Medicare Advantage plans. So that's an easy way to fill in those gaps, but they also have their own standalone plans that you can get if you go the supplement plan route. So those all share pretty similar features. These next 4, however, do not share those same features and act a little bit differently, and they can be a lot higher when it comes to the dollar amounts and the risk to you. So the first one that I want to talk about would be long-term care expenses. This is such an important conversation to have, and most people don't want to have this conversation. But for those who make it to age 65, 71% of them will need long-term care at some point in their life. Now, long-term care is different than skilled nursing care because remember, Part A does cover skilled nursing. We have a whole video on what that entails. But long-term care is not skilled nursing. What Medicare will cover, and we had a client actually put it this way, and it is a little bit harsh, but it's pretty accurate. Medicare will cover you getting better or you getting dead. And what that means is that if you are getting better, if you're going into some sort of a rehab and you're getting better with skilled care, they'll cover that. That's part of something that's included. But if you're not getting better and you are progressing towards death, that's where Medicare will step in and cover hospice. But that in-between stage is not something that Medicare covers. And that's a big stage with a lot of financial risk. So if you think of things like a nursing home or any of the help like home health care when it comes to the activities of daily living, like toileting, continence, bathing, dressing, transferring, or eating, those are things that are not covered by Medicare. So those costs are significant. And those are the things that can wipe out an inheritance. Those are things that can send families into bankruptcy. I have personal experience with this with other family members, to where if they go into a nursing home or they go into Alzheimer's care or dementia care, that is something that is not covered by Medicare, and that gets really expensive really quickly. So when it comes to this gap, take the time to sit down with your agent or a long-term care planner who can discuss this with you and help you understand how to avoid this financial risk. Really, the options you have there are to self-fund, so to put it into some sort of an account where you can accumulate enough to take care of that. HSA dollars can be used towards long-term care expenses. What we would recommend oftentimes, if you qualify, would be to have a long-term care plan. That's an actual plan that you can purchase and will help you alleviate those costs for you and help you avoid that severe financial risk. The seventh gap that original Medicare does not cover would be care outside of the US. Now, there are a couple of notable exceptions to that. One would be if you're traveling to or from Alaska from the lower 48 states and you happen to need care in between there in Canada. There are certain circumstances where that would be covered by Medicare. Or if you live right on the border of the United States and, let's say, Canada, and the closest hospital is in Canada and not the United States, then there are certain instances where that would be covered. However, for the vast majority of instances where you would need care outside of the United States, original Medicare does not cover that. And there are a couple of ways that you can cover that, or at least prepare yourself. The first is that with most Medicare Advantage plans and Medicare Supplement plans, there is some sort of benefit or coverage for emergency situations outside the United States. How this usually works is a reimbursement program. So you would have your emergency services while you're outside the United States or traveling. You would pay for those expenses, and then when you submit your claim back to your Advantage plan or your Supplement plan, then they would reimburse you for the amounts that fall under their coverage limits. The other thing that you could do to cover care outside the United States if you're going to be traveling would be an actual travel insurance policy that is going to cover more things than just emergency care. It'll cover things like evacuations as well as things like losing your luggage. So that's another option for you if you are going to be traveling. It is a little bit more predictable in terms of what it covers than the emergency side of things, but those are your two options when it comes to care outside the United States. The eighth gap to discuss would be excess doctor charges, and you would think of this as visiting doctors that are not participating in the networks. If you're on a Medicare Advantage plan, the way to avoid this would be to visit doctors and facilities that are in network with your Medicare Advantage plan, because if you go out of network, those charges will either be a lot higher or you would be responsible for 100% of those costs depending on your Advantage plan. If you go the Medicare Supplement plan route, you would face excess doctor charges if you visit a provider or facility who does not participate with Medicare. So again, the way to avoid these excess charges would be to make sure that you're visiting providers and facilities that participate with Medicare. The ninth and final gap to discuss would be unapproved charges, and think of this as trying to get services or procedures that are not deemed medically necessary by Medicare. The easiest thing, or at least the lowest hanging fruit on this one, would be plastic surgery that is purely cosmetic. Medicare isn't going to cover that. If you are looking to get procedures that are not deemed medically necessary, then Medicare is just not going to pay for those. The easiest way to cover that gap is not get services like that, or you're going to have to use your own funds. So have some sort of a financial fund that is available for you to use, that is your own money that you would use to get those types of services. Those are the 9 major gaps that are left unfilled by original Medicare. If you found this video helpful, please consider subscribing to our channel and giving us a like. If you have any questions around these gaps, please don't hesitate to reach out to us at 90daysfromretirement.com. As always, we appreciate you and thank you for watching.